So the treatment of metastatic clear cell RCC has really evolved in the last 2 years. We know that there are various standards that's evolved, going from the era of monotherapy with VEGF TKIs in the 2000s to the last couple of years, where we've seen now multiple randomized phase 3 studies that shows that combination therapy is effective in this disease. So when we look at a patient with metastatic kidney cancer, we look at various factors. There are patient factors, there are treatment factors, and there are disease factors. So for patients, we look at whether they would be potentially able to tolerate certain therapy. We look at logistics of the therapy, whether this is oral versus intravenous. We look at whether patients have comorbidities or potentially if they may have organ dysfunctions, which will impact the type of selection of therapies that we choose. In terms of the disease, we use generally IMDC risk factors to look at whether patients are favorable, intermediate, and poor risk disease. But on top of that, where the disease is, how symptomatic the patients are, those are all important factors as well. And when we look at treatment, generally in oncology, including kidney cancer, we look at overall survival benefit. And certainly in patients with metastatic clear cell RCC, we see that patients with intermediate poor risk disease, there are now multiple standards. One is the combination of ipilimumab plus nivolumab based on the checkpoint 214 study, where patients were randomized with epi-nivo versus Sutent, and there is a definitive survival benefit leading to FDA approval approximately a year ago. And more recently, in the axitinib plus pembrolizumab study versus Sutent again, where patients across all risk groups were randomized to Sutent. And in this study, there was overall definitive survival benefit in this study. So the two standards of care right now in the treatment of metastatic clear cell RCC are these two combinations. But we've seen FDA approval for another combination, axitinib plus avelumab, which was recently presented in this conference as well. So there are now multiple combinations to be considered for patients with metastatic kidney cancer.